Good evening, everyone, and greetings from The Hague, the Netherlands. My name is Peter Hotchkiss, and I'm the Senior Science Policy Officer at the OPCW. I want to thank the organizers for reaching out to me to see if I could contribute to this event. I had not heard of the Night of Science before, but I feel it's really a fun and important event, and it helps communicate the interesting and necessary work that scientists do that benefits all of society. And in fact, it is kind of this point that is the main subject of my talk. How do we ensure that science benefits all of us and is done in a way that is trusted and accepted? Sounds easy, yet scientists are faced with moral and ethical dilemmas all the time. Before I begin, I want to provide a shout out to one of our science interns, Amaya, who did the lion's share of the work in putting this presentation together. Let's begin our story with Fritz Haber. Born in Germany in the mid-1800s, he went on to become a world-renowned chemist and scientist, helping cement Germany's place as a world leader in the sciences. He even received the Nobel Prize in Chemistry in 1918 for the Haber-Bosch process, in which ammonia is synthesized from nitrogen and hydrogen gas under high temperature and pressure. As we know, this allows for the production of vast amounts of ammonia that can then be used to make ammonium nitrate, used extensively as a fertilizer in agriculture, but also as a component in explosives. In fact, it's estimated that around 2/3 of annual global food production makes use of this process, dramatically increasing crop outputs and fundamentally changing the way society approaches agriculture. However, Fritz Haber is also seen as the father of chemical warfare for his work on utilizing chlorine and other toxic gases as chemical weapons in World War I. Haber was actively involved in the creation of a specialized unit for the use of gas warfare and was even physically present when chlorine was first used in the Second Battle of Ypres in 1915, resulting in over 65,000 casualties. He recruited other notable scientists such as James Franck, Gustav Hertz, and Otto Hahn, all future Nobel laureates, to this special unit. And interestingly, he was also involved in the development of gas masks for protection. Haber was known to be proud of his contribution to the war and did not consider chemical weapons any more cruel than conventional firearms. In the story of Haber, we see how intimately ethics can be involved in a chemist's life and choices, not only because of his involvement in World War I, but also considering the relation between the Haber-Bosch process, modern-day agriculture, and our current climate crisis. Although as a chemist, there is often no greater joy than discovering a new molecule or inventing a new process, these innovations do not remain isolated in the lab, but have consequences on the world around us. One of the earliest examples of a renowned scientist having a moral dilemma with their own work was Alfred Nobel, seen here on the lower right. Alfred Nobel was born in Stockholm, Sweden in 1833. Nowadays, he is, of course, most well known for his creation of his namesake Nobel Prize, but he's also famous for the invention of dynamite. It turns out that dynamite was not originally developed for war purposes, but during his later years in life, Nobel actively pursued the development of different weapon materials. In fact, Nobel had a good friend, Bertha von Suttner, with whom he corresponded frequently, and who is considered to be an influential character in the international peace movement at that time. It's thought that their friendship had an impact on his thinking and is one of the reasons for the creation of the Nobel Peace Prize. It is said that Alfred Nobel did not consider his involvement in the war industry and in the work for world peace as incompatible elements. Rather, he gave expression to the prevalent 19th century understanding, which maintained that the scientist was not responsible for how his findings were used. He, I would say rather luckily, died before he could see the effects of the First World War on Europe, where his invention of dynamite was used extensively. There's then a growing perception in the 20th century of the need for ethical considerations in science. Of course, we already spoke of Fritz Haber, but we have also Albert Einstein, born in Germany in the late 1800s. He received the Nobel Prize in Physics in 1921 and is well known for his peace activism. He was actually close friends with Haber despite some fundamental differences on certain topics. And, well, who did we sneak in there amongst those pillars of science? Why, Walter White from Breaking Bad, a renowned chemist in his own right, I suppose. He chose to make methamphetamine an illegal recreational drug because he was dying of cancer and wanted his family provided for after his death. This in and of itself is an interesting ethics moral dilemma. We could see many instances today, both in and out of science, where people struggle with right and wrong and the consequences thereof. History was made on the 29th of April, 1997, when the entry into force of the Chemical Weapons Convention, the world's first multilateral disarmament agreement to provide for the elimination of an entire category of weapons of mass destruction within a fixed time frame. The event marked both the culmination of many years of painstaking negotiations, as well as the birth of an international chemical weapons disarmament regime headed by the Organization for the Prohibition of Chemical Weapons, or the OPCW. The OPCW strives to fulfill the convention's mandate to end the development, production, stockpiling, transfer, and use of chemical weapons, to prevent their reemergence, to ensure the elimination of existing stocks of such weapons, and in doing so, to make the world safe from the threat of chemical warfare. It should be noted that although the Chemical Weapons Convention is primarily designed to eradicate chemical weapons and to prevent their reemergence, it also contains important provisions relating to the promotion of free trade in chemicals and the open exchange of information and knowledge about the peaceful applications of chemistry. The OPCW is headquartered in The Hague, where I currently am, in a very uniquely shaped kind of half-circle building. Our operating budget in 2021 is around 70 million euros, and it's staffed by around 470 people from over 80 countries. In addition to its main headquarters, the OPCW also has a small lab facility close to The Hague. Though I will mention this will soon be obsolete as we're building a brand new state-of-the-art Center for Chemistry and Technology to be ready in the next couple of years. In the last 2 decades, 193 states committed to the Chemical Weapons Convention, representing 98% of the global population, and over 98% of the declared chemical weapons stockpiles have been destroyed. So fantastic progress in terms of the convention. And in fact, so fantastic that in 2013, in recognition of its extensive efforts to eliminate chemical weapons, the OPCW was awarded the Nobel Peace Prize. And in 2017, just a few years ago, it commemorated its 20th anniversary. In spite of this tireless work, however, we still see the horrific use of chemical weapons. In fact, in the last 5 years, there have been a troubling reemergence of the use of chemical weapons, with numerous attacks conducted by non-state groups like ISIS, as well as attacks allegedly perpetrated by some state governments. Despite having overseen the destruction of over 98% of the world's declared chemical weapon stockpiles, the work of the OPCW is far from done. Let's go back to that aspect of the OPCW promoting chemistry for peace. This is written into the convention. You can see it here in Article 11. But what does it mean? We need to remember that chemistry is all around us. It's in the way we produce our food, clothes we wear, the products we use. It's been used in hugely influential ways through the development of medicines, for example. But chemical innovations can also present huge challenges for society, especially when they're misused. The OPCW focuses on a number of different activities in the different sectors of industry, academia, and government. These are comprised of activities ranging all the way from raising awareness through education and outreach to facilitating exchanges of chemicals, equipment, and scientific and technical information, and all types of things in between. The philosophy behind all these activities is to promote a culture of ethical thought within chemistry that is grounded in the idea of the betterment of humankind and the protection of the environment. So, scientists, what does ethics have to do with us? Well, Because scientific innovation has consequences in our environment and societies, there's a need to facilitate a continuous dialogue on what ethics in science means, not only in relation to chemical weapons, but in relation to society and science at large. It's important that we all have a better understanding of what it means to conduct science in an ethically responsible way and how we can ensure that ethics is ever present in our thoughts. And so I very much hope that the rest of this presentation will give us some good things to think about. It's interesting to note that research on ethics in science commonly distinguishes between two domains, the internal and the external. When it comes to ethics, scientists will often immediately think of the internal domain, which include issues such as scientific misconduct, integrity, trust, and impartiality. While this is often included in scientific education, the pressures of doing research make misconduct widespread. Look at some of the results of a survey conducted in Belgium just a few years ago. Ethics are a prevalent part of conducting research, and scientists are often, knowingly or not, needing to make choices that speak to their grasp and acceptance of ethics. Some of you might remember the case of Diederik Stapel in the Netherlands in 2011, 10 years ago, who was dismissed from the University of Tilburg for the fabrication and manipulation of data. Around 60 of his publications have since been retracted. Fortunately, cases of this scale are rare. However, not all scientific misconduct entails huge infractions. Sometimes these actions can seem quite insignificant, such as neglecting certain safety measures in a fume hood because of added time pressure, or adding a colleague as an author on a publication when he or she actually didn't contribute that much to the work, or when you clean up some data to make a graph look better, such as by removing solvent peaks in a spectrum or deleting an outlying data point. We also have what is considered the external realm of ethics. Less emphasis seems to be placed on the external realm, but this too is incredibly important. This is especially relevant in the context of the OPCW in terms of the issue of dual-use research in chemicals. Dual-use materials are chemicals, equipment, knowledge, or processes that can both be used for peaceful purposes, but can also be misused to cause harm, like as in a method of warfare. And you can see here a table that kind of shows some of these external domain features based on responsibility, who's responsible, and who it impacts. So let's go now to a hypothetical case study. This can seem quite abstract, so let's think about, as scientists, the types of choices that we may have to make. So you are a researcher interested in the H5N1 virus, bird flu, a deadly virus with a mortality rate of 60%. H5N1 predominantly spreads through bird-human direct contact, but does not seem to spread easily through human-to-human interactions. This is good news, as the virus could otherwise cause a disastrous pandemic. You want to know if the H5N1 virus could ever mutate into a virus that would be infectious through human-to-human interactions by becoming airborne transmissible. Would you try to experimentally create an airborne transmissible H5N1 virus in your laboratory and then publish these results? Interesting question. What's even more interesting is that if your answer is yes, you're not alone, because this is in fact a real-life example of the importance of considering ethics in science. Two research groups were confronted with this very choice in the beginning of this century. It turned into a huge controversy in the scientific community just around 7-8 years ago in 2013. So let's take a look. In 1997, the virus H5N1 spread across huge populations of birds worldwide with devastating consequences. There was a concern that if the virus mutated and would become transmissible to humans, it would lead to a pandemic. So in 2006, a revered scientific panel identified the need for research on the possibility of bird flu becoming transmittable from person to person and started funding a number of research projects to this end. It should be noted that dual-use concerns did not come up at this time. Two research groups separately developed an airborne transmissible bird flu virus and submitted this for publication. The esteemed scientific journal Nature, where these results were submitted, asked the U.S. National Science Advisory Board for Biosecurity, the NSABB, to review whether this research was safe to publish. They took this quite seriously. 22 voting members took almost 6 weeks of deliberation, sending hundreds of emails and having over 20 hours of teleconference calls. The NSABB ultimately recommended publishing a redacted version of the research. What this means is publishing the conclusions, but not the methods or the data. This is notable as it was the first time that the NSABB had recommended this type of restriction. The main argument of the review board was that it could prove dangerous to put so-called a recipe out there on how to create a transmissible deadly virus. The researchers argued that the potential benefits of gaining insight into potentially lethal or dangerous mutations, which could then also be used for vaccine development, outweighed these potential negative consequences. Needless to say, this all sparked huge international debate. Interestingly, the NSABB reconvened a couple of months later and voted in favor of publishing, though not unanimously, the entire set of research, citing not just the ethical issues, but also some political and economic drivers. This case exemplifies the need to develop solid guidelines, processes, and ways of thinking about ethical decisions within research and how to communicate this to a broader public. It also touches on some fundamental questions and challenges in this field. Things like, who should decide whether to execute and publish certain experiments? What is the best way to publish sensitive information while minimizing risks? Is redacting papers a slippery slope to censorship? Why wasn't the research flagged at an earlier stage as perhaps being an issue? This brings us to the Hague Ethical Guidelines. Oops. One of the activities that the OPCW has undertaken to facilitate the active engagement of the chemical community on ethical thinking and the promotion of the responsible practice of chemistry was the development of the Hague Ethical Guidelines. The Hague Ethical Guidelines is built on existing codes of conduct and codes of ethics in order to formulate a harmonious and universal guideline for the chemical profession. It was developed by a group of experts from over 25 countries around the world. It's important to note that these are guidelines. They're not rules, they're not laws. Given the subjective nature of ethics, it would be quite challenging to develop a firm set of rules by which everyone has to follow. At the same time, it's important to have guiding principles. And in fact, you could relate this to kind of something like the Hippocratic Oath that doctors take, a set of guidelines to follow that help. So the Hague Ethical Guidelines has a core principle. The core principle being that achievements in the field of chemistry should be used to benefit humankind and protect the environment. Now, what I want to do now is go through some of these key elements of the guidelines and talk about them. First is sustainability, a core element of the Hague Ethical Guidelines. The Sustainable Development Goals, developed and curated by the United Nations, are a call for action by all countries, poor, rich, and middle income alike, to promote prosperity while protecting the planet. They recognize that ending poverty must go hand in hand with strategies that build economic growth and address a range of social needs, including education, health, social protection, and job opportunities, while tackling big issues like climate change and environmental protection. Many of these goals require scientific research and innovations, such as the development of affordable and clean energy, but also goals like better healthcare, climate action, access to clean water, etc. And there are the SDGs. Let's talk about another example, Challenges in the global energy transition. Sounds easy, right? For a long time, society's energy needs were dependent on coal, oil, nuclear energy, things that are not environmentally nice and potentially extremely hazardous. But now we have a lot of new science and innovation that allows us to harvest energy from renewable sources. So all of this should be a no-brainer, right? We convert as quickly as possible. Well, multiple studies have shown that accelerated delivery of international public finance will be critical to energy transitions, especially in developing economies. But ultimately, it's the private sector that will need to finance most of the extra investment involved. Mobilizing the capital for large-scale infrastructure calls for closer cooperation between developers, investors, public financial institutions, and governments alike. If we look at the graph on the right, we can see that record flows of finance have been pouring into the energy transition, increasing yearly and totaling $500 billion in 2020 alone. However, mature renewable energy technologies account for most of this investment. We can see by looking at the graphs on the right, however, that reaching our energy transition goals by 2050 is going to require further rapid development of available technologies, as well as widespread use of technologies that are not even on the market yet. Major innovation efforts must occur over this decade in order to bring these new technologies to market in time. It's predicted that by 2050, almost half of the emissions reductions that we see will come from technologies that are currently only at the demonstration or prototype phase. It could be argued that big energy still puts billions of dollars of investment into technology to support energy production that doesn't meet our future needs. So how do we balance the investment in past versus current versus future needs of energy R&D? Should this be solely the decision of private companies, or do governments have a role? And how much of a role should they have? And what happens when different countries take different approaches? These are all important ethical, moral questions when it comes to energy and science. Education. Knowledge is not only created by individual scientists, but it's fundamentally shaped by the structures and institutions in which they operate. The Hague Ethical Guidelines therefore emphasize that there is a strong need for collaboration between formal and informal education providers, enterprises, industry, and civil society in order to equip anybody working in chemistry and others with the necessary knowledge and tools. There's a growing recognition that STEM education should not be taught as isolated subjects, but should include societal and ethical discussions as well, what we call systems thinking. This is especially important in the European context, given that there are currently huge shortages in qualified teachers. 80% of European countries reported shortages of teachers, and over half have reported an aging teacher population. To this end, the OPCW has actively worked on creating educational materials for students, educators, civil society, and policymakers to include the Hague Ethical Guidelines, and even has a special advisory board dedicated to education and outreach. Closely related to education, the Hague Ethical Guidelines underline the importance of raising awareness and engagement that promote the peaceful uses of chemistry and the potential risks of the misuse of chemistry. The OPCW has taken a proactive stance towards this and organizes numerous trainings to build the capacity of member states to implement the convention and facilitate professional networking and knowledge exchanges. The OPCW provides things like national implementation programs, assistance and protection programs that enhance the capacity of states parties and their first responders in the case of incidents involving toxic chemicals, international cooperation programs that promote peaceful and secure uses of chemistry, integrated chemicals management, enhancing laboratory capabilities, chemical knowledge promotion and exchange, and many other activities. In fact, on the lower right, here's just one neat example of the importance of awareness and engagement. This chemical, thioglycol. widely used for industrial purposes like synthesis of dyes, lubricants, pesticides, and plastics, and in ballpoint pen ink, among others. However, this chemical is also a precursor in the synthesis of mustard gas. Knowing all the good and benefits that chemistry and science brings us is important, but equally important is understanding that without proper education, awareness, and communication, science can unfortunately be misused as well. To adequately respond to societal challenges, education, research, and innovation must respect fundamental rights and apply the highest ethical standards. Ethics should not be perceived as a way of ensuring high quality results in science, or rather it should be perceived as a way of ensuring high quality results in science and not as a barrier or an impediment to science. Let's go ahead and take a look at another interesting case where the discussion over ethics continues, and this is gene editing. CRISPR-Cas9 is a genome editing tool for which Emmanuelle Charpentier and Jennifer Doudna recently won the Nobel Prize in Chemistry. Using CRISPR-Cas9, researchers can change the DNA of animals, plants, and microorganisms with extremely high precision. This technology has had a revolutionary impact on the life sciences, is contributing to new cancer therapies, and may make the dream of curing inherited diseases come true. But let's remember that innovations that receive Nobel Prizes are not inherently ethical. CRISPR-Cas9 has sparked huge global debate and created large-scale media attention in some very interesting cases due to ethical considerations. Some of these include a plan to release thousands of genetically modified mosquitoes in Burkina Faso in 2018 as part of a research project to eradicate malaria. Outrage and condemnation from numerous scientists upon hearing when it became known that a geneticist had modified a gene of 2 baby girls to make them immune to the HIV virus. Or when a research team reported a novel genetic strategy to fix malfunctioning blood cells in sickle cell disease. In fact, there are even do-it-yourself CRISPR-Cas9 kits available on the market. There's a movement that's trying to make genetic research more easily accessible to the general public. It's an idea that research should not be done in only laboratories or at universities or companies, but everyone should be able to do it. And of course, the Hague Ethical Guidelines cover the responsibility that all chemists and scientists share in making sure their efforts, their work, is not used for illegal, harmful, or destructive purposes. This includes not just employees and students, but supervisors who have an active and never-ending role in overseeing and providing the appropriate guidance to others. Unfortunately, we have some sad reminders of what happens with lack of oversight. Here are 2 examples of the disastrous effects that can occur when there is no adequate regulations, procedures are not correctly followed, and/or when employees do not have the necessary understanding or qualifications. On the right, we have the explosion in Tianjin in August 2015, a blast caused by a mix of chemicals at a waste warehouse in the port. This warehouse was thought to contain some pretty nasty and hazardous chemicals, things like calcium carbide, potassium nitrate, ammonium nitrate, and sodium cyanide, amongst others. Yet at the time, it was a challenge for the warehouse to give a proper catalog of all the chemicals it had on site to the authorities. This was important because initially only a fire had broken out. But this was made much worse when firefighters, trying to fight the fire with water, which is a pretty standard reaction, instead caused an explosion. The water is thought to have mixed with the calcium carbide to produce flammable acetylene gas. The explosion of this then went on to detonate the various nitrates present, causing a massive, massive explosion. It's also worth noting that the storage facility should have been, by law, more than 1 kilometer from residential areas, but this was not the case. On the left, we have the more recent explosion just last year in Beirut, Lebanon, where 2,750 tons of ammonium nitrate, which had been stored in a warehouse at the port for the last couple of years, detonated unexpectedly. Over 200 people were killed, over 6,000 injured, and an estimated 80,000 homes and buildings damaged. There had been multiple warnings and reports by officials in the 6 years previously to move the stored ammonium nitrate, which had originally been confiscated from a cargo ship. But it just never happened. Lastly, let's briefly discuss the element of information exchange. In order to build the capacity worldwide of peaceful uses of chemistry, the Hague Ethical Guidelines argue for the exchange of scientific and technical information. Scientific knowledge exchange has always been bound by complex discussions and regulations. Think of open access publishing, patenting, relationships between universities and industry, and the corresponding confidentiality agreements, or the return of investment versus public good. There's really some gray areas when it comes to exchange of information. Let's just go through a few examples regarding patents. One is very relevant today, COVID-19 vaccines. Last October, India and South Africa submitted a proposal to the World Trade Organization to waive the patents of COVID-19 vaccines in order to lessen the inequity of vaccine manufacturing and distribution. The proposal received a lot of support from more than 100 emerging countries, but has been opposed by a number of Western countries. It turns out that the WTO, a key element in the trade and movement of vaccines globally, operates under consensus. And so the patent waiving cannot move forward even if a majority support it. It said that even if the waiver is granted, there are still significant challenges. One of them being that the production of vaccines is actually a pretty complex scientific endeavor. And not all countries have the necessary expertise or equipment for doing so. In fact, a third voice in the debate is the pharmaceutical industry, which remains against the waiving of patents, arguing that this is not about profit, but about practicality, and that instead of waiving patents, what is needed is removing trade barriers, export controls on raw materials, and the hoarding of wealthier nations. They also argue that patent rights are a crucial component for innovation and investment. This last point could be argued, however, given the fact that, at least in one case, the Oxford AstraZeneca vaccine was developed with 97% public and charitable funding. It's also questionable if the motivation of scientists is dependent on whether or not the developed vaccine is subsequently patented. Another example, seen here on the lower right, is the human gene patent case that reached the US Supreme Court in 2013. Very interesting case. It concerned whether or not companies had a right to patent naturally occurring human genes. The court case was initiated by two advocacy groups against the company Myriad, which had legally awarded patents on the genes BRCA1 and BRCA2, which are used for diagnostic genetic tests for breast and ovarian cancer risks. There are various forms of gene patents, but this case focused on the patenting of isolated genes. The patents that were issued for these strands of DNA meant that once the patent was implemented, no one was allowed to look at a patient's gene for the presence of specific mutations or use that gene in research or clinical testing without permission from the patent holder, this company Myriad. This practice had been going on in the US for over 20 years. Myriad had a complete monopoly on BRCA testing in the US and enforced its patent rights strictly, charged a lot of money for the tests, and did not even share the clinical data with the international scientific community. In previous cases, the Supreme Court had declared that both products of nature, air, water, minerals, and etc., as well as laws of nature, things like the law of gravity, are so fundamental that they cannot be patented. Why then was DNA being allowed to be patented? The Supreme Court voted 9-0 that a naturally occurring DNA segment is a product of nature and not patent eligible merely because it has been isolated. This was an important case as it touches upon scientific freedom, medical progress, and the rights of patients. It also shows that the challenges of communicating science to a broader public. How do you explain in court what a gene is, what DNA is, why isolated DNA shouldn't be seen as an invention but a product of nature? Quite challenging. One way, of course, is by using the appropriate metaphors. In this case, think about it like this. Isolating DNA is like extracting gold from a mountain or taking it out of a stream bed. You might be able to patent the process of mining the gold, but you can't patent the gold itself. These two cases are not meant to advocate against patenting. Patents can serve many useful purposes. It can protect an invention and give control over how it's taken to market by the inventor. It can also promote discoveries by stimulating researchers to add value to the invention and can make expensive research worthwhile for investors due to a higher likelihood of return on investment. But they do show that not everything should necessarily be patented, and sometimes patenting rights can conflict with the public good. What is needed then is the incorporation of ethics in thinking about not only patenting, but in what ways knowledge should be exchanged for the betterment of humankind and the protection of the environment. And with that, I'll conclude with a simple quote that I think is quite fitting. Ethics and scientific research is not about knowing the right answers. It is about asking the right questions. I want to thank you all for your time, and I now invite you to join me for a live interactive session where we can think a little more about some ethical questions. Thank you. So, hello everyone. I'm Peter Hotchkiss. I'm joining you from here in the Netherlands in The Hague, and I'm here with one of my colleagues, Amaya, and we're going to go through a quick live interview. Sorry about that, I lost my internet. Great, I see people joining in. If anyone else wants to join, go ahead and then we'll move forward. Great, Amaya, do you want to go to the next slide? So, after hearing the presentation, what are important aspects for you regarding ethics in science? And you should see some answers on your device that you can choose. And it's not too late to join if you'd still like to join. Let's see. So basically enter any word you can think of that reflects your thoughts on ethics. Okay, first few are in. Integrity as a researcher, always. Responsibility. Patents, education. All of these are great answers. I see responsibility is standing out. Great. All right, should we move on to the next question, Amaya? So let's go back to the case we heard about the bird flu. What would you do in this situation? If you were a researcher and you had options, would you try to create the virus in the lab and try to publish all the results like the real researchers did? Would you perhaps only want to publish some of the results in a redacted version due to some sensitivities, or would you simply not try to do this type of research? Okay, I see a few answers in. The interesting thing about all of these answers is there is no wrong answer. And that's what makes ethics so interesting yet challenging at the same time, is different people have different views. Interestingly, it's looking pretty evenly split. Although definitely a minority of people would want, oh, no, pretty evenly split. That's interesting. All right, Amaya, should we move on to the next question? Great. How much do you agree with patenting? Here are some options: an existing crop, a paperclip, a toy whose new aspect is that in addition to talking to humans, it can also talk to other toys, a human gene, a climate change mitigation technology, COVID-19 vaccines. Do you think all of these are okay to patent, or perhaps some yes, some no? So interestingly, not a lot of enthusiasm on patents. As we saw during the talk, also very subjective in what should or should not be patented. Great. Do we have one final question, Amaya? So, do you believe codes of conduct are important? And have you ever read a code of conduct in your field or profession? Looks like most everyone agrees the codes of conduct are important. And I think the majority of people have hopefully read a code of conduct in their profession. Is that all we have, Amaya? Yes. So anyway, we wanted to do something that was a little bit interactive. I want to be conscious of time, knowing that things started a little bit later, and that you have plenty of other great speakers to hear. But I want to thank the organizers again for letting me talk, and thank all of you for taking part in this short interactive quiz. Have a good rest of your evening.